Welcome. I'm Dr. Stuart Miller. I'm chair of the internal medicine department at Huntington Health Physicians, and I'm here with my associate.
Hi, I'm Dr. Kimberly Schreiner. I'm the Director of Infectious Diseases and Infection Prevention at Huntington Hospital.
And we're here to talk to the community about COVID, and particularly the upsurge recently that we're experiencing. So, from an outpatient physician, I want to talk to you about signs and symptoms that you may be feeling. And my suggestion is that if you are having any high fevers, nausea, cough, shortness of breath, anything like that, then go and get tested. Either get a at-home test, or there are several community outlets where you can get it, including public health services. And you can probably go online to the Pasadena Health Department and find those available. Um, if you do turn positive and you have rather significant symptoms, then I would say for sure isolate, rest, get good nutrition, hydration, treat with over-the-counter preparations like Tylenol, uh, maybe call your physician and get some further advice. If you think you might be a candidate for Paxlovid, then the physician can talk with you about that.
Thank you, Dr. Miller. I would emphasize all of the things that Dr. Miller has said. We want to try to prevent you from getting COVID to begin with. As Dr. Miller has said, we are currently experiencing a significant surge of a much more infectious version of Omicron. And so we really want people to try to protect themselves as much as possible. How can you do that? We all know how to do that now. We've been so experienced with this pandemic. The first is think about the activity that you're going to participate in. Am I going to be unmasked? Is it going to be indoors or outdoors? Could there be people there that I don't know their status, their vaccination status? Those are considerations that you want to make before you participate in activities. The second is stay up to date on your vaccinations and boosters. It's unfortunate that the vaccines don't seem to actually prevent infection, but they are designed to prevent you from getting seriously ill, being hospitalized, and the worst case scenario, dying from COVID. So please get vaccinated and boosted. If you're above 50, we recommend a second booster, so you'll actually have a total of 4 vaccines. Get them as soon as possible. It doesn't matter whether you mix up Pfizer, Moderna, they're equally good, and you can get them at any local pharmacy. Finally, the easiest, safest protection that we know works effectively is what Dr. Miller and I are doing right now, wearing masks. These happen to be N95 masks, which are the highest quality masks that really prevent transmission and infection. It protects you. It also protects the people around you. You can also wear KN95 masks, which are highly effective, and surgical 3-ply surgical masks in areas that are well ventilated and not indoors. So please make conscientious decisions about what you're doing. We expect this surge to last about 10 to 14 days. We've been through this many times before. When it rains, you take out your umbrella. When we have a COVID surge, you wear your mask.